Welcome to the first MindCog series. I will soon be starting the Spravato treatment next week for my treatment-resistant severe depression. I'm going to do follow-up videos each week during the treatment to give insight on the treatment, how it is helping me, what it's like, and the results each week if or as I notice any difference. If you'd like to be notified when new videos are published, click the subscribe button below. First off, let's go over what the Spravato treatment is. Spravato is an esketamine nasal spray that can be administered in the presence of a doctor, usually at a clinic. While Spravato is known to help with multiple mental health issues, I will be doing this treatment for my major depressive disorder that is treatment resistant. I have also been having problems with suicidal thoughts and ideation again, which esketamine has been known to help with as well. I'll give you a bit of a backstory overview of my struggle with depression. As far back as I've been able to track it, my depression started when I was about 12 years old. At the time, I didn't know what was going on with me, only that something wasn't right. Mental health wasn't something that was openly talked about, and I had never even heard the term mental illness before. Over the course of a few years, I made 3 cries for help, each of which went unanswered. After the 3rd cry for help, I finally just gave up. My thought was, why should I care if no one else does? One of the things you learn very quickly with depression is that no one wants to be around someone who is down, sad, and quiet all of the time. As a result, I learned how to hide it, as most people with depression do. When I was around people, I would throw up a sort of fake personality. I watched people for a while and learned body language and how to read it, and when a smile was appropriate to something being said, or when a laugh was appropriate. I was able to see from their body language when someone was talking, when they thought that what they were saying was going to be humorous or should be amusing in some way, I would know how to react from watching that body language. Even though I didn't feel the laughter or smile, I would do it whenever the situation required it. I made sure that when I was around people, I kept no expression on my face in passing and walked with my back straight as much as I could. My depression went untreated until I was about 21 years old, and I finally crashed completely. It was towards the end of my first semester in a new college course, and I went through a breakup with someone. Even though that I had only known the person for a few months, it was the one snowflake that is too much and causes the avalanche. I was admitted onto the psych ward at the hospital because the therapist I saw felt I was a danger to myself. My family doctor did not feel comfortable treating me for my depression, as he felt the severity of my depression was outside of his realm of comfort for his ability to treat, and I was referred to a psychiatrist. I was no longer able to work at all, nor could I handle school. It was a struggle just to get out of bed and move to the couch in the morning, where I would then just lay and watch movies all day. About every 2 years, I would try returning to work, but would end up in the hospital sometime within 3 weeks of starting. And over the course of the next 15 years, I went through every medication and medication combination that my psychiatrist could throw at me. There were a few that started to help, but after a few months, they would suddenly just stop working. I went through 10 sessions of ECT. I had a stay at the Homewood Health Center in the Comprehensive Psychiatric Care Program. I was also referred for trial programs in both deep brain stimulation and transcranial magnetic stimulation, but both doctors running the trials didn't feel I would be a good match for the program with the type of depression that I had. On average, I was on the psych ward at the hospital 3 times a year, anywhere from a week to a month at a time for being suicidal, and sometimes also while they did a medication change. I did have suicide attempts. The last attempt found me waking up in ICU with a breathing tube down my throat, heart monitors, 3 IVs, and a bladder and bowel catheter. About 2 or 3 years ago, I was given the ketamine infusion treatment at my local hospital. The treatment wasn't as successful as everyone had hoped, but it did have some benefits. The depression and anxiety got a little bit better, and the suicidal thoughts and death fantasies weren't as intrusive as they were. I was able to start working again, although I could only manage one 5-hour shift a week, but it was a start. Over the last few years, I've been able to get myself up to 15 hours a week consistently. The odd time I would be able to do a 20-hour week for a short period of time before going back to 15 hours. The summer of 2020, I started to notice the depression getting worse again. It wasn't a huge change, just small, and started declining slowly over the months. I am back to a big loss of interest and motivation. There's more isolation than I used to do, and the death and suicidal thoughts have started getting stronger and more intrusive. Because of this and how hard it was for the doctors to get me to where I am today, my psychiatrist and I agreed to do the Spravato treatment. So that's a brief overview of my story and where I am today. I wanted to be able to document the Spravato treatment for others. I know how hopeless things can feel when you are treatment resistant and nothing seems to be working. I hope you'll join me in the future videos of this series and that I'm able to help you get an understanding of this treatment option, what it's like, how it helps, and how quickly you can start to see some results. If you liked this video and want to stay up to date on new videos as they are published, please click the like and subscribe button below. Until next time, have a great week.